My brother Jeff Stemberger was engaging, outgoing, and a compassionate man. He had a great devotion to his family, and he also was a man of great faith. Through his efforts and through this diagnosis, he had turned around and actually believed that maybe some people could learn and benefit from his experience.
I think Jeff would be thrilled if one person saw this video and saw their physician and got screened and we prevented one esophageal cancer. I think he would feel that this was a worthy exercise if we prevented one more death from esophageal cancer.
Life can be difficult. Cancer is a difficult diagnosis. It's difficult to research. But every once in a while, someone comes into our life that is extremely courageous and brave. Jeff Stemberger filled that role.
My dad was a person of great faith and a big heart. He had a lot of faith in people. He had a lot of faith in God and himself. And he truly strived to bring out the best in others.
So Jeff was diagnosed with esophageal cancer at the age of 42. He was having trouble swallowing and came to his primary care physician, who immediately recognized some challenges and went to do some lab work and found out immediately that that's what he had.
Jeff is a patient that I will remember for the rest of my life. Every time I met Jeff, he was always concerned about me. He was concerned about my family. He was concerned about how I'm feeling. And I would always joke with him. I would say, dude, you're the one that I should be worried about and not you worrying about me. But that was Jeff. He was always concerned about you and your health and how you're feeling, despite the fact that he was suffering from this tragic condition. When we initially diagnosed Jeff Stemberger with esophageal cancer, we felt it was treatable. He underwent chemotherapy and radiation and then underwent surgery, and we initially thought that we had cured this cancer.
So for the next year, Jeff took treatment. He was involved in a trial, and he did a great job of engaging with all the staff and all the people that happened to provide service to him. That was his outgoing way. That's what he did.
Jeff was a very spiritual guy, and he felt that this was supposed to happen to him. Despite this tragedy, he felt this was supposed to happen to him. And the reason that this was supposed to happen to him is that he wanted others not to suffer the way he suffered.
Physical changes in my father were at first minimal. Very little was noticeable. We had already had times before his diagnoses where we couldn't eat around him or talk very loudly, have conversations at the dinner table, and he would have some distress, some heartburn, frequent trips to the bathroom, things like that. And even after the diagnoses, nothing really seemed to change much from before. After a while, though, we were able to notice loss of muscle mass, being able to see through most of him, his bones, things like that. He looked very gaunt. Those were difficult times. And for him to be fighting cancer as well as giving hope, it takes an extraordinary amount of faith.
Unfortunately, soon after his surgery, we ended up having metastases, and tragically that led to his death. It was a 1-year tragic journey that we all lived through. Jeff Stemberger was an awesome individual. He became my friend over the last year of his life. His final words to me was, "Tell everyone my story," with the intent of preventing another person from suffering his fate.
His medical team had come to me and asked, because of the way that Jeff had changed their outlook on esophageal cancer with such a great disposition and a great energy, They were wondering if it was possible to take to Jeff the possibility of starting this esophageal cancer fund in his name.
Jeff was a devoted family man, a great husband, a great dad to his 2 sons, and a great employee, such that his whole organization was involved in his care and helped establish the fund that allows us to produce this video, because they strongly felt that his death should not be in vain. They wanted to support his desire to prevent esophageal cancer.
Kathy and the boys had asked me to eulogize Jeff, and I was so moved and touched by his interpretation of the people he had helped and the difference he had made that I found a invigoration in what the cause had to be.
Kevin has taken the baton from Jeff and taken Jeff's mandate to tell everyone his story and prevent esophageal cancer, and taken this nationally.
Because of Jeff's fund, we were able to get introductions into major research institutions. And it is through that exposure that we have become a little more active in research of esophageal cancer.
Jeff would be extremely proud of Kevin and all the work he's done to educate patients and to fight for research funding to increase education and research to esophageal cancer prevention.
In essence, the National Cancer Institute has elevated esophageal cancer up to a major cancer in the last several years.
We've made a great progress in preventing Barrett's. We're understanding why Barrett's starts. We're able to intervene if there are precancerous changes that start. And we're also able to endoscopically remove early stage cancers. These were things that we didn't have to offer when Jeff was around. So I think Jeff would have been really thrilled in our ability to prevent esophageal cancer in the last 10 years.
I think Jeff is smiling today on this team and the efforts they continue to put forth on his behalf.
We've been inspired by the legacy and mandate from Jeff Stenberger to offer the best care for patients with Barrett's esophagus and early esophageal cancer.
I want to believe that we are well on our way, but I know that there's a long road ahead of us. And I know that a lot of research has to be done. But with my father's legacy and with the strength of those who helped us through this, we want to ensure that no one else will be affected.
Yes, he most definitely has his hand in the progress that is being made. He was very humble and he would not take credit for it, but he knew the importance of even one soul's contribution to advance outcomes. We continue to be inspired by Jeff as he inspires others.